Many mood disorders can be traced to a chemical imbalance in your brain that sometimes can't be treated with therapy or coping strategies alone. Medication might be needed. And here with us to discuss is Wendy Anders, Sweetzer's Senior Director of Community Services. Wendy, thank you so much. Important topic. How do you know if you need medication rather than just therapy?
Well, that can be rather tricky. Oftentimes what has to happen is you have to try that least intrusive approach first. And if someone is feeling like they need some help, and trying therapy is a good place to start. But if it's not working, then consulting with your therapist about whether or not there's some other alternative that could be considered. The therapist would then involve a psychiatric nurse practitioner, a med prescriber, and ask them for their input. They would get a consult with the med prescriber to see what, if any, other alternative medication treatment could be considered. Then they work as a team to, be able to try a medicine and see whether or not that has an impact on the symptoms. But what we encourage folks is, if you're not even receiving services currently and you feel like you could use some kind of help, start by going to a clinic. Go to your local clinic, your local PCP, let them know your concerns, what you're experiencing. They will refer you to get a full comprehensive assessment. Like at our clinic, you can get a full assessment. And from that assessment that's done by a licensed clinical social worker, for example, they may make a recommendation for a med consultation, and then our med consultant would then involve themselves and prescribe what might be necessary.
Okay.
So you don't have to know anything walking into a clinic and just saying, look, I just don't feel right. Help, what can you do to help me? Starting from there, and we will help figure out what it is that they need.
And then once you are prescribed medication, how is it managed?
Well, our clinician, psychiatric nurse practitioners, for example, at our clinic, they partner with all of the other service providers that are involved with the individual. So it might be the therapist and the case manager and their primary care physician, for example. And together they work as a team because they want to make sure that any side effects are managed. They want to make sure that the most optimal outcome is happening. Typically, results don't happen from just one or the other, just medication or just therapy. A combination of both can also be very, very successful.
And if someone is considering this at home who's watching, what might be some of the questions they would be asked or that they would have to answer if they were seeking therapy or treatment in medicine?
Well, we'd want to know if there's some kind of behavior or symptom that's interfering with their daily function. Are they able to sleep? Are they able to focus to a task? Are they able to get up out of the bed in the morning and do a daily routine of going to work or school? Those important things. Are they feeling some discomfort physically that might be warning, a concern for them? Anything that doesn't allow them to do their normal routine could be a reason to consult with their PCP or a nurse practitioner or their therapist.
Are there any openings for people who need medication management?
Sure. At our clinic that we have in Sanford, our certified community behavioral health clinic, we have 2 nurse practitioners on staff and immediate capacity. And I'm imagining that other clinics as well, if you're not in the area of Sanford, could also benefit from having someone come in. We have a clinic in Brunswick as well. But yeah, I would start with my therapist or my PCP or going to your local clinic.
All right, Wendy Anders, Sweetzer's Senior Director of Community Services. Thank you so much for your input and great information.
Thank you.
Yeah, we appreciate it.